And we're back. Good morning from downtown Blue Ridge, the beautiful shops at Sycamore Crossing here downtown. Before I got riled up a little bit, you know me if you've been watching the show. Sometimes I get riled up and never know what I'm going to say. First of all, so I want to make a clarification and an apology to Sheriff Chris Clinton. Clinton, no F. My uncle is Clifton, so I have an F, but anyhow, Chris Clifton, Sheriff of Towns County, I apologize. Did I say that again, Clinton? Did I put the F in it again? What? Thank you, Lonnie. Now you know what you're here for. Okay, Chris Clinton, Sheriff of Towns County, my apology to you. Very nice man.
And not related to Hillary.
Not related.
No.
Thank you, Dr. Whaley.
Okay, I just wanted you to know that.
Okay, I have Dr. Whaley here with me, and I have the Sheriff of Fannin County, Dane Kirby. Glad to have you, gentlemen. Dr. Whaley, before the break, while we were at the break, you and I were talking. We were right here, this setting right last week, discussing Dallas.
Yes,
and
well,
just a week later, I mean, in America, are we going to just come every Friday and have to discuss, I mean, from Orlando to San Bernardino, the list goes on.
Yeah,
I mean,
I don't know. I just wanted to
welcome, gentlemen.
Yeah, thank you. I just wanted to say one thing before we get on to talking about medical marijuana. I was online with some of my sort of special operations contacts last night. One of them pointed out to me that in 2010, in the English language edition of the ISIS magazine and newspaper, they presented the scenario that happened last night. They said that a truck can be used as an instrument against soft targets where people congregate. Take a firearm so that before you are brought down, you can use a firearm to mow the crowd down, and that the numbers will be high. And you can go look it up, but it was printed in 2010 as a cookbook.
You brought something up that we're struggling with. Sheriff, why we have you there and we're on this subject, we're going to talk about medical marijuana. We have a 30-minute segment here, but we are sitting here this morning, and every day in America, it seems like we're facing something different when we get up. And we are talking about Nice, France, where 84 are dead and hundreds plus are injured this morning, where a gentleman drove a box truck through a crowd that was at the French Riviera, I think it is, and they were enjoying Bastille Day like our 4th of July. Soft targets. And before we get into medical marijuana, he brought something up. We are here, and you know what? People are going to say to me, you shouldn't say that. But you know what? It's time where it's not, we shouldn't say that. We should talk about, we're in Blue Ridge, this beautiful place. I have seen 10,000 people downtown. Mm-hmm. I mean, talk about soft targets and just a minute, and what that means to you more today than it maybe did 10 years ago.
Well, you know, we've always liked to feel like we're kind of protected here in Fannin County, and
right.
that we're immune from a lot of the stuff that we see going on in other parts of the world and other parts of our country here, but I don't think that's a safe way of thinking anymore.
Thank you.
Yeah, I think that we need to look down the road and you know, have a much broader view of some of the possibilities of some things that could possibly happen to us here in Fannin County, and do everything we can to prepare for it. And you know, we've been doing that ever since I've been sheriff. We've been taking steps to become, you know, to be able to handle a wider variety of catastrophic things that could happen here. And God forbid it ever does, and I hope it don't. But you know, if it does, we'll be a whole lot more prepared to deal with it now than we were before.
Well, you know, I say that, and like I said, I don't want anybody upset because we live in a beautiful community and we live away from things. But I always call it also the mindset sometime of it could never happen here.
Yeah, that's dangerous.
And that is a dangerous mindset, and that's where we're at in a lot of America. So I'm going to move on, unless you gentlemen want to say anything else, you're more than welcome to. We're going to move on to talking about medical marijuana. First and foremost, cannabis oil. Medical marijuana, cannabis oil, I think the challenge right now for a lot of Americans, Georgians, is marijuana, illegal use, and all the mental pictures, and it can be used the wrong way. But there's a side that it can be used correctly too. I have a young lady over here that's gone from 80 seizures to 3 by cannabis oil. But we're going to let the doctor discuss deeper where it's effective. But today in our society, the large spectrum in our region of drugs and the different kind of drugs you deal with just in this county, the different kind. Go through a couple of them that you deal with, illicit drugs in this county today.
Yeah, the one that causes us the most problem is meth. We see more of it, and it seems to have a more of a devastating effect on families and users than anything else does. Marijuana is common, as it's always been. Prescription drugs are a common thing. We see a lot of that, not as much as we did back when it was, in its heyday, when it boomed there and kind of peaked and was the talk of the town, but it's still out there, and it still causes some problems. Abuse does.
Let me ask you a question. Prescription drugs, you walk in, law enforcement, and I say walk in, but you suspect prescription drugs. I don't carry my prescription with me.
Right.
But how do you investigate prescription drugs if they're in a bottle, if somebody has them or something? How do you investigate and get to the point of deciding that they shouldn't have those drugs?
Well, there's a statute that says that controlled drugs have to be in their original container.
Okay.
Now, granted, that's something that you want to be reasonable in enforcing, because a lot of people have their Monday through Friday
Right.
pill container
An
that
AM
they
and
put in their
PM.
pocket, their
Right.
AM and PM, that they carry with them every day. So you certainly don't want to, to interfere with those people's practices, or give the guy a hard time that's got his blood pressure pill laying on his console of his pickup truck when he's on his way to work speeding in the mornings, or anything like that. But that's one tool that you can use. And investigating prescription drug cases has to be done just a little bit differently, because there are people who do have legitimate reasons to have prescription drugs, of course. Right. I'm yet to see a prescription for methamphetamine.
Yeah, I haven't seen that one.
I'm yet to see a prescription for marijuana. It's a whole lot different, so you have to conduct your investigations just a little bit differently.
Okay, let's get to that. But I've always wanted the opportunity to actually speak with a physician, a doctor, much like yourself, Dr. Whaley, and actually ask you how when you have to have a prescription for something, does it get out into the market? How do those kind of drugs get out? When I say in the market, in the illegal market, the underground market, how do they get out and come into the hands they shouldn't be in?
Before they get sold at the high school, you're talking about?
Yeah.
Okay. It used to be, and we see almost none of it now, that they used to rob drugstores. But the new methods of drugstore inventory control, they don't have huge amounts of narcotic drugs in-house, and they've got video cameras, and they've got alarms, and they've got safes. Mm-hmm. So most of it now is actually diverted out of the prescription market. Right? You've got, I'll run through them in just a minute, but it's diverted out of the prescription market rather than robbed from a pharmacy. There are 4 ways that you can get prescription drugs out of the legitimate use and into the illegitimate use. The first is that there are physicians who are out of date, and patients know about it. They have not kept up with the proper indications for writing prescriptions of narcotic drugs or Xanax or sedative drugs, and they're just need education. They're just out of date. The second one is the professional patient, the doctor who gets duped. It's very easy to explain that. You have a patient who has a kidney stone on his x-ray. He goes to a doctor in the morning and he gets 18 pain pills. When he does his urinalysis, he sticks a needle under his thumbnail and he urinates across his thumb, and there's blood in his urine, and the doctor gives him a dozen pain pills. He leaves his office, goes across town, goes to another doctor's office and does it again, maybe gets one in the afternoon. Wow. And by dark, he's got 36 pain pills.
I'm sorry, you're just catching me off guard. I mean, I just can't think like that. Wow.
Okay, now, and he's got a different 3 he sees every day. And he only goes back to doctor number 1 a month later. And a month later, when he goes back, the doctor says, well, he's only used a dozen pain pills in a month, and he writes him another dozen pills. So that is the doctor that is being duped by a professional drug shopping patient. We tried to put together a mechanism in Georgia to detect that by computer tracking of scripts, but leave that alone. The third is the disabled doctor, the doctor who's using it himself or trading the drugs for sex. And you've recently had a community event in a neighboring county where there have been physicians and other people that are alleged to have had that sort of a relationship and have been caught. And the third is the very minimum number of physicians. I'd say it's one in 1,000 who are just plain dishonest and are writing hundreds and hundreds of prescriptions for non-existent people and diverting drugs. So all of those are D's: out of date, duped, disabled, and dishonest.
I thank you very much, because I'm just caught off guard when you're talking about it. It makes sense when you talk about the professional user that goes into the doctor. Now, Sheriff, you said something a minute ago, and I want to bring us around here. You said prescription drugs, we're going to move to medical marijuana. We moved to, and you said, I know that's not something they have a prescription for.
Said I've never seen a prescription for marijuana.
Right.
Correct.
Now we're moving into legislation. I heard a segment we did a couple of weeks ago. We're moving into legislation where somebody would have to have a colored card that is issued for marijuana. Let me talk about this for a minute. When I met with Dale Jackson and Melissa Searcy, and we sit here on this couch a couple of weeks ago, I heard opiates. I heard them talk about opiates. I heard them talk about using those for drugs today that prescriptions are written for. Talk about illegal drugs that can be used medically and where that ties into cannabis oil.
Okay. There are two drugs that are in the illegal spectrum that are called Schedule I drugs that have legitimate use. The first is cocaine. And it's used in a very small amount by ENT specialists, head and neck surgeons. They put it in the nasal cavity and the sinuses. When they're scoping, it causes a real shrinkage of the mucous membranes and the blood vessels, and they can really see good. It opens up the pipe, so to speak. Almost none of that's used. The second is, and I participated in the original clinical trials of a drug named Marinol. And that drug has been on the market now for 25 years, I guess. Legitimately, it is approved by the FDA as an appetite stimulant in patients with HIV. Cancer patients who have poor nutrition, we've utilized it in cancer patients with poor nutrition. It's been studied as a nausea drug for chemotherapy patients. It's not terribly effective, but you can use it for that purpose as a sort of an add-on drug to other drugs if they're not working. So those two examples are the illegal drug that have medical purposes, and the Marinol is specifically just one small chemical of the 400 or more that's in a marijuana plant. The marijuana oil that you mentioned earlier, every legislative discussion of marijuana oil talks about low THC, meaning tetrahydrocannabinol, which is the active psychoactive ingredient, has to be lower than the amount of non-psychoactive ingredient that is extracted from the marijuana plant. Now, the problem is, we know what penicillin is. I mean, it has an exact formula. We know what aspirin is. It has an exact formula. When you talk about marijuana oil, you're talking about various strains of marijuana. My daughter's got 4 or 5 tomato plants. They all got different ones. Some of them going to be big, some going to be little. They're all tomato plants, but they're all different.
Well, I hate to put it like this, but, and I do not think how I know this, okay? But you got your tomatoes, you got your Jersey boys, you got your beefsteak, you got this.
That's right.
You got your marijuana, you got your Hawaiian.
You do. That's exactly right.
I don't know that.
Yeah,
I've heard that. Okay?
Yeah, that's correct. All right. You got your Acapulco Gold.
Sheriff, I have no idea what that means.
You got your Acapulco Gold and whatever. And in Colorado today, the medical community, and in California, the medical community, clearly do not know what strain they would want to use for what. And so when you have the production of marijuana oil, low THC oil meets all those criteria from one manufacturer, his source of oil might be the big boy tomato.
Okay.
And the manufacturer across the street might be the beefsteak tomato oil. And that you can't scientifically compare the two. So the science of trying to study these things is extremely difficult.
You're shedding a lot of light for me
all right.
this morning.
Yesterday there was a release of some preliminary information about the clinical trial going on at the Medical College of Georgia of the use of marijuana oil in seizure control. Mm-hmm. Now, most of the publications about the legitimate attempts to study marijuana products are related to neurological conditions, because the cancer people, we've about given up of it being an effective pain drug. It's not. It being a good nausea drug. It's not. It being a great drug to stimulate your appetite. It's not. We do use it. We add it on to other therapies. But the place that it seems right now to have the highest degree of interest is in various neurological conditions. It's been studied in Parkinson's disease, and the Parkinson's people don't think it works. It's been studied in multiple sclerosis. They don't think it works. It's been studied in cerebral palsy. They are enthusiastic about the results that they've seen in a subset of patients. They want to study it more, and they're trying hard to do it. And the one that's got the most press is seizures. Now, every single article that's been published, there's an article by the American Epilepsy Society, there are articles in the medical cancer literature and in the Journal of the American Medical Association, you call the great unwashed of doctors. All of them say there's no real good clinical trial, there's been no comparison to other seizure drugs, but where we have had a limited number of patients, nobody's got more than 50, we have noticed that a subset of these patients have a dramatic response to marijuana oil or the oil. Now, the point is, where did that oil come from versus the other set of oils? So the products that you are going to study all have to come from a U.S. federal supply, because the only legitimate supply of marijuana for study in the country is federally supported.
I don't want to interrupt you. I don't like when the word government and control comes into place, but is this not something where we can have a controlled substance to balance that out, to get an equal something to work with?
That's a really great question, because the federal legislation is that it all has to come from their supply, and their marijuana gardens at the University of Mississippi, and it's run by a real nice guy named Mo El Soli that's a friend of mine. Now, the products that are coming from Colorado and coming from California and coming from Washington State are coming under state law and not federal law. So Dane can discuss this law more than I can, but the way I read the Georgia law is that they have chosen, as about 30 other states or 23 other states, to allow the use of low THC marijuana oil in people who have a certificate from a physician certifying the likelihood that this patient will benefit from it, and then they have chosen not to enforce a prohibition, and the local law enforcement people have chosen not to prosecute those folks. Now, under federal law, they are still technically violating the federal law, but as I understand it, and as each of these articles that I've brought out that are very, very recent, I mean some of them in the last few weeks, the Department of Justice has chosen in states that have these laws not to go open your mail or come in and apply federal rules in these states. I mean, they're doing it, they could if they wanted to. And if it seemed like you were abusing it, they could do it, but at least they've chosen not to. Now, my understanding is that in the states that have not passed these laws, they got more things to do right now worrying about terrorists and stuff than they are worrying about this. So they don't have a task force out there trying to get marijuana oil out of some kid's prescription treatment in a state that does not have these laws.
Let me ask you a question in a short time, because you brought up something and you're piecing together something I heard in our first segment. And folks, our plan is eventually you're going to see this area full of children, families, physicians, and law enforcement. Oh yeah, we could have 30 people out here with chairs on a Friday morning. This could happen real soon.
Maybe next Friday.
Maybe.
Which
But
we had some. Parents.
Now I got to work next week.
No, we had parents that said they wanted to come next Friday.
No, we do.
Yeah, we have some
Okay,
parents
yeah.
and some patients that want to sit on this couch next Friday.
No, we're good with it. In fact,
We're good.
we're going to
Okay, I
keep this up.
understand.
But let me ask you the question,
Okay,
because
go
you
ahead.
brought this up, and I know in a short time. So there are families going to Colorado
Yes.
and getting cannabis oil.
Yes.
And there are families
They're
that
not.
are.
No, they're not. They're going into Colorado. They're looking at where the cannabis oil comes from, and then they're having it shipped to themselves.
Okay.
They're not putting their suitcase.
No, they're
and
not
flying.
traveling with it, because
Yeah,
that's
right.
interstate
yeah, you know,
and
they got that.
FBI, because cross state
Yeah,
lines.
right.
Okay, let's back up. But they are going to Colorado, then they're seeing the cannabis oil, they come back and they order it.
Yes.
But we're hearing different levels of success stories from this, different levels from the individuals that use it. They have their own stories. But what you're telling me this morning is this individual could have imported a cannabis oil that the strain was a little higher, this one was a little different, and this one was a little
Correct.
different.
That's correct. Yes.
That's what I'm hearing.
That's correct. Now, my understanding is that the study going on at the Medical College of Georgia, that's the first study this Georgia law allows the 4 medical schools to establish a clinical trial utilizing the product for a laundry list of conditions that are in the law. So it's my understanding, and I haven't talked to the clinical investigators at the medical college, but that they have a study, and they have about less than 50, but more than 40 people on that clinical trial. Now, there's the funding for something like that. It's hard to get because there's no drug company like Pfizer or something pushing it.
Exactly.
But in those circumstances where there are, say, 40 or 50 people, the published studies will show that somewhere around 15 or 20 get a fabulous response. Now, nothing's 100%. I mean, so you don't. It's not like every kid that has refractory seizures is going to be benefited by the oil, but you never know till you try. Now, you may well find that the penicillin didn't get the infection, but Keflex did. And so the medical community, in theory, would test different strains of marijuana oil in a condition and say, well, the beefsteak tomato oil is a lot better than the other one. How do you get that
I like
funded?
a Jersey boy myself.
A Jersey boy, yeah, okay. Well, how do you get that funded, Who do you get to manufacture the oil? Right now, no pharmaceutical industry is making the oil.
Right,
It's
so we
being
don't
made
have a
in
pharmaceutical backer that's bringing
Well,
that
it's being made in the
research
health
back to
food.
the
It's
table.
being made in the health food industry.
Right, exactly.
And the health food industry is not regulated. Not regulated by the FDA. It's got squat for regulation. And when somebody puts out a thing that says it's a memory stimulator, if you'll remember back when they were first talking about the memory drug, what it's Balboa, whatever that stuff is, when they started analyzing it, they found that a lot of that came from China, and it had stimulants in it like ephedrine. Well, ephedrine's now, that's what you make methamphetamine out of. And so what it said on the bottle, rose hips or whatever, ginkgo balboa or ginkgo biloba or whatever it is, that you can't.
Yeah, ginkgo biloba.
Yeah, ginkgo biloba. You can't trust that. I mean, there's nobody that really is looking at that and saying we stand behind this product as having exactly what it says in it.
And for
period.
that reason,
Doctor,
there,
go
Bill,
ahead.
would it not be risky for a doctor to use things like that?
Well, the doctors generally don't use stuff like that. No doctor is writing a prescription for marijuana oil. They're writing an authority that says marijuana oil might help this child, and then it's up to the family to find a source.
Okay.
The doctor did not approve the use and did not prescribe it. He simply said This is a circumstance that falls within this law,
Okay.
and I can certify that this child has epilepsy, and this child is not doing well on all the drugs that I have that I can legitimately prescribe, and it is not unreasonable for the family to investigate where they could get marijuana oil from and administer it to this child, and there's a reasonable chance it could help that child.
Gotcha.
Before we wrap up, I want to ask you something, Sheriff. Within the Sheriff's Association, within some of the conferences and stuff, is this some things that is on the talking points, medical marijuana, the law enforcement side of it, things that may
It
be
is,
coming
Brian.
down the road?
It has been a big talking point in the past, and the association, through the collective sheriffs across the state, have adopted a position on the medical marijuana. Now, law enforcement does not want to get in the way of successful treatment for medical conditions
I can
for
respect
anybody.
that. Right.
But at the same time, you know, just like I can tell, just like Bill has concerns about marijuana, so does law enforcement. And, you know, the things that we oppose are delivery through smoking, for one thing, and we oppose marijuana for recreational purposes. Now, I think some of the states have actually drafted legislation that allows
Four.
marijuana use for recreational
4 states
purposes.
and the District of
Yep.
Columbia.
Yeah. Not in Georgia. I don't
No,
think.
well, the Georgia Sheriff's Association specifically has a statement that they are in favor of the research for the uses of medical marijuana,
yeah.
medical research.
Yeah, absolutely.
Gentlemen, we're gonna have to end it there this morning. Thank you, Sheriff. I don't want to interrupt, but
That's
we're
okay.
gonna have to stay skilled.
Because I got to go to
You
work.
got. I was
Yeah.
just getting ready to say you got to go.
And
to
we
work.
can be
But
back in a week.
Sheriff Dane Kirby, thank you very much.
Thank you,
Dr.
Brad.
Whaley. Folks, we're talking, and let's just say like the discussion. I mean, we have the subject, we have a discussion, and this is great. We have 2 segments on it. We have families. I'm your host, BKP. We have families that want to come here and be in the area here with doctors, other law enforcement, and keep this discussion going. Thank you. Now, if you have anything that you would like for us to ask Dr. Whaley while we have him here on Fridays, our number is 706-889-9700, our chief at fetchernews.com. And, you know, if you're wondering, I know I call this my Caddyshack blazer, okay, from Caddyshack. Or for some of you that are a little older, you might remember WKRP in Cincinnati. And
Oh, yeah.
Herb Tarlick.
Yeah.
You remember Herb Tarlick?
Yeah.
This is my Herb Tarlick jacket.
The jacket you had last week, you got from the Broken
Yes,
Bull.
yes, I
And
did.
it was a very nice
Yes.
cloth jacket. And I said, "Oh, you've got an Italian jacket."
That's right.
And you said, "No, I got a Broken Bull jacket. It's not
Exactly.
Italian, but it looked Italian, and it's,
Well,
it's
this
very
is
nice
this
jacket."
is my Herb Tarlick
right,
jacket, okay? Herb Tarlick was the slick salesman on WKRP in Cincinnati. You know how that went? Baby, if you ever wonder whatever became of me. I'm living on the air here in Blue Ridge, WBKP. Lonnie, go to break.